Okay, now let us move on to our next participant. So she graduated with a degree in Doctor of Veterinary Medicine from UPM in 2008 before pursuing the doctorate study at University of Glasgow in 2009. So he's currently a senior lecturer in UPM, and the research works involve with omics applications and biomarker discovery in various diseases. So ladies and gentlemen, please welcome our next contestant, Ms. Rozaihan Mansor.
Well, do you know that when a person is diagnosed with a clinical illnesses or diseases, a treatment modalities that is prescribed by the physician is actually not always 100% successful? Well, take an example as cancer as an example. So cancer is actually, can I start all over again? Sorry. Let's start.
You can't, you need to continue. Just continue.
Okay. All right. So do you know that when a person is diagnosed with certain illnesses or diseases, a treatment modalities that is prescribed by the physician is not always 100% successful? Well, take cancer as an example. Although the traditional cancer therapies such as radiation, chemotherapy, or even radiation has succeeded to a certain extent, however, this limits the success of a treatment because of the heterogeneity or differences in the molecular level among the patients and in particular within the tumor itself. So what happened is that these cancer interventions is actually lacks in the specificity. So when it is lacks in the specificity, it actually hinders the outcome of the treatment. In the post-genomic era, there has been a greater knowledge on the human's genome, epigenome, transcriptome, proteome, and even metabolome. And this is collectively known as the omics approach. So this omics approach actually has led to the discovery of various disease biomarkers. And these disease biomarkers can be actually used to detect early stage of diseases, and it can also be used to predict the disease progression, the outcome of the disease, and as well as the drug responses. So with integration of this omics data, we can actually have come out with a novel molecular signatures or molecular markers which can be improved, which can be used to improve prognosis, which then can also be improved to treat the patient successfully. So with this omics data as well, we can also use to improve or to enhance the therapeutic developments so that it can be further improve the prognosis or the conditions of the patients. Thank you.
Thank you very much. Questions and feedback from the judges?
Hi, how do you make sure that data will not be unethically used?
There would be no issues of ethical issues, because this is how we actually compile all these omics data from a gene informations of a human up to a metabolites of the human, and this can be actually used to actually detect any markers, any disease biomarkers earlier. So it shouldn't be an issue of ethical anyway.
What's stopping us from finding a cure for cancer today?
Sorry?
What's stopping us from finding a cure for cancer today?
Well, it is particularly because of the molecular differences. It would be differences among the patients and within the particular tumor itself. So that this is why you can see that most cancer patients will have relapses, okay? Because not all treatments actually give beneficial effects to the patients.
Any other questions and feedback from the judges? So if there are no more questions and feedback, thank you, Dr. Rozaihan, for your presentation.